and the county government to come up with the policies on how documentation should be done. I must say a lot of work is happening within the government cycles. When Dr. was presenting on a holistic approach, one of the key things was nutrition. And the government has come up with a program together with the partners, development partners. We call it MICH, that is Nutrition Inclusion in the Cash Transfer. And it was due to the study which was done. And initially, that is 2015, it was a pilot which was done in the county of Kitui and the county of West Pokot. One, you look on the child first, then facilitation later, or is the other way around. So we need to be, and that's what the government now is doing. The Children's Act 2022, that is part 6, subsection 1. It gives a strong commitment for the national government to work closely with the county governments. I know there could be still some arm of us, but it will be for this generation only. The coming generation will understand how it should be done. Yeah. You know, we are past
caveat that it doesn't present a full picture of what's happening in Kenya. It's based on the studies that APHRC has carried out. So I'm going to present some findings from the work that we've carried out in specific counties in Kenya. So when you look at the current situation in terms of childcare, when you think about what's happening in the childcare space, there is an increasing demand for childcare services. And one of the issues that drives this is the increasing participation of women in the labor market. More women are joining the labor market, and those with young children need somewhere to leave their children safely, where they can consider that their children are getting appropriate care and that they will have peace of mind when they're away. Somebody mentioned mboches in the morning. I don't remember who it was. I don't know if mboche is the term that's used or... No. Nannies. Nannies suggest that there are small kids. When there are no small kids, households, domestic workers. Okay, domestic workers is the politically correct term. Please let's remember to use that one. Quality childcare and women's economic empowerment, looking at how improving the quality of childcare services can enable women to join, remain, and advance in the labor market. Because many of the women that we've talked to talk about being retained in low-profile jobs. These are the ones that are available to them, mainly because of their education standards, and also they do not have opportunities to advance themselves. So we wanted to get them to a place where they're able to also look at the higher level jobs and feel confident enough to try and get into such jobs. So we can, this slide is just showing, it has several frameworks in place. So we need to keep having those discussions so that we can get to a place where we have all these, I would call them basic infrastructure, to improve the sector in place so that we can move forward with other issues. What are the opportunities that we have for influence? We need to increase awareness among different stakeholders about the importance of quality childcare, and I think this is one of the forums where we can keep talking about quality childcare and just increase that. Hopefully, it will result in increased recognition of the importance of this sector. We're saying frontline healthcare workers can be mobilized to enhance the quality of childcare provision while they carry out their regular work, which is looking at community health and wellness needs. We want to have impactful stakeholder engagement. We don't just want to have meetings in hotels. Everybody say yes, no more meetings in hotels. Yeah, we want to move out there. We say to the community, qua ground, we need to go to the ground and see what's happening there. We can have those discussions in the hotels, but let's move on with action after that. And then there is need for streamlining regulation and licensing of childcare facilities, because this is crucial for improving quality in this growing sector. Very important. We want our children to receive the best care that there is possible. So I think that is my last slide. Thank you very much for listening. I am representing a research organization, and our main responsibility, or our main role, is to find out what's happening. The way to improve the childcare facilities, we have evidence on how that can be done. We will need to work with the implementing partners, implementing organizations, to see how the quality can be improved. There's a representative here from Kidogo. I think she can talk. Is she here? Yeah? Yeah, I think she can talk more about the efforts that they're putting to improve the quality of the childcare facilities. And I know Kidogo is expanding their reach very rapidly. And I think we'll get to a point where at one time, they will be the to-go-to provider for quality childcare services because of the way they're rapidly expanding. I know there are other players like Tiny Totos also in this space. And I think if we bring those efforts together, then we can get to a place where implementers can support government to improve the quality of the childcare service provision. The first question is difficult. And I think when we think about night care, these are some of the adaptations that we need to think about to be made to the childcare service provision. We know that there are some women who go to work at night and they need to leave their children. Night care is not as visible as daycare, because night care we are asleep and we don't really know much about what's happening with the night care facilities. But I think that's an opportunity for us to just try and get more evidence on what's happening with the night care provision. We know it may not be as widespread as the daycare provision. And in fact, one time there was a discussion or a conversation around whether we should refer to the sector as daycares or childcare. Because childcare would cover both night and daycare. But daycare suggests during the day. So I think we need to do more work around night care service provision and find out what's happening. And then on the issue of childcare providers giving children a periton to sleep, I think this has to do with increasing their awareness of how to improve the care that they're providing for young children. And if we center that discussion around the nurturing care framework, the different components of the nurturing care framework, I think we can get to a place where they understand that children need to be, for holistic development of children, they need.
Every year on June 16th. It is an important milestone and a reminder of the struggles and liberation of children in Africa. The day provides African governments with the opportunity to review progress made in protecting and promoting the welfare of children, setting new goals and strategies to enhance them. The theme for this year is Education for All Children in Africa. The time is now. In Kenya, the day was launched on 9th June 2024 in Kitui and will be celebrated at Mwatate Primary School in Taita Taveta at a function that will be presided over by the top government officials. The event will bring together key stakeholders such as the national and county governments, civil society, caregivers, religious organizations, private sector, among others.
That I think have emerged and that would make the campaign to provide quality, accessible, affordable, inclusive childcare for all a reality. One important thing that we must point out and has been alluded to here is the potential and strength of partnerships and collaborations, taking a multi-sectoral approach, which can enable us to pull together our scarce resources, bringing everyone that should be brought on board, building bridges across movements. We're talking about childcare movement, we're talking about women economic service, so that you don't look for pay, but look at the delivery of services that we give out. The other thing that I think I need to point out, identifying opportunities, the leverage points, and areas where we need to make our emphasis. What's already going on in the country? Around the idea of capacity building that was raised by Mr. Nzenge, there's a process with the NETA to develop a childcare giver curriculum to train childcare workers. A research revealed that the curriculum being used to train children are fragmented, and there was a need to develop a harmonized curriculum. And this is already ongoing with actors in the country that include those that I see in this space. So that's an important opportunity.
Is number one, first, we are going to map out to see the availability of legal and policy frameworks that supports childcare and caregiving. Number two, we are going to use to identify, to map out the best practices in childcare. For example, Kidogo, Time Totals are doing a wonderful job, but are they in the 47 counties? Is there a message that they can pass on to the other counties and encourage more mothers? So we are going to use what is available or not available. We voice that to ensure that it is available. If it's policies that are not there or that are there and the implementation is a challenge, we will voice it. We are going to come up with messages targeting various actors in the childcare space. And all this is meant to empower the caregivers, to give information on gaps to the government, to give information on capacity building of the caregivers or the managers, as they are calling them, and also to support other caregivers who are struggling to ensure how can they use resources available within the community or within the family to provide quality care, to enable children to play and stimulate all of their senses.
So much for the questions. I'll also add that the work is going on in terms of our daily responsibilities, but all we are saying is we are amplifying it. So it's not a new conversation. We just want it to top people's minds for the next 6 months. And after that, we measure the output. Has it had any effect? Have we moved the needle further? Because collectively, we are moving with the child at the center. But now we are saying, okay, let's give ourselves 6 months. We've outlined what we want to achieve, the messaging, and then after that we measure, because they say what is not measured has not been done. So we want to ensure that at the end of the 6 months, we are able to demonstrate that if we have these conversations every day, making it a lifestyle, it's going to have an impact on how childcare is done or offered in Kenya.
That use of data to inform policy and interventions is key. And the bigger picture is, why are we here? Because Africa is facing a childcare crisis. It is estimated that there will be 1 billion children living in Africa by 2055. And we know that 80% of African mothers work in the informal sector, and they depend on substandard, unreliable, informal babysitters for ad hoc care. We know that unreliable childcare keeps women from becoming entrepreneurs. Poor childcare keeps women and children grounded in cyclic poverty. And we know that if children do not get access to quality care, they may never be able to reach their full adult potential. And that's why we are here, to tackle the childcare crisis in Africa.
Back to the point about financing. So as we begin the new government fiscal year from July, how about having childcare be mentioned in the spaces whereby